This is Utano podcast with me, Lenias Hwenda, where we talk about health in Africa with individuals and leaders who are at the forefront of transforming health in Africa. Coming up next on Utano podcast, I will be having a conversation with Professor Frederick Chite Asirwa, the Chief Medical and Hematological Oncologist who is leading cancer control programs at the International Cancer Institute in Kenya. So tune in next week. We will be talking about cancer, one of the leading causes of death worldwide. In most African countries, the medical needs of the majority of cancer patients are simply not being met and haven't been met for many decades, like many other non-communicable diseases. In fact, cancer has been neglected by African health systems for a long time. Few countries have national cancer control programs, and those that do are not allocating enough budget to address the problem. Health facilities are far away from people, there are not enough oncologists, and not enough diagnostic services. And few countries have routine screening, which helps to detect cancer early and get people on treatment quickly. Routine screening is very important because it allows cancer to be detected early and a diagnosis to be made, which is the first thing that must happen in order for a patient to get the right kind of treatment. This is important because every specific type of cancer often needs a specific treatment regimen, which can be surgery, radiotherapy, or chemotherapy. So it's important to know exactly what you're dealing with. When cancer is detected early, it is more likely to respond to treatment better. It is less likely to require more complex and more expensive treatment, and patients are far more likely to survive the journey. The challenge facing most countries in Africa is that diagnosis is not happening at all. And so most cases are detected in much more advanced stages when treatment is less likely to be successful for the few lucky ones who can afford to receive treatment at all. For most people, the necessary treatments are far too expensive and beyond reach. Coming up next on Utano podcast, I will be having a conversation with Professor Frederick Chite Asirwa, the Chief Medical and Hematological Oncologist who is leading cancer control programs at the International Cancer Institute in Kenya. So tune in next week to hear what he has to say about how big the challenge of cancer is on the African continent and what the new government of Kenya needs to be prioritizing in order to close the gap in care for cancer patients.